Hello, I'm Dr. Elmer, and this is video lectures. In fact, we're changing the name to Advanced Neurospinal Corner. I'm the doctor at Advanced Neurospinal Solutions, and I'm a structural correction specialist, but I'm also a board-certified functional neurologist. Today we're going to discuss what is a disc bulge and compare it to a disc herniation. One of my patients' grandmas was interested in that. She has a son who has that problem. So let's talk about that, and that's my first specialty is structural correction. More to come on that, what structural correction is and how we do it. But in order to understand this, we have to talk about what is a disc, what does it do for a living, and then how it can get bad, and then how it can change and become good again, or at least better than it was. When we look at a disc, the discs are between the vertebra, and when we look at the individual vertebra, there are 24 parts to that system, and in between each is a disc, except for when you get up to the top in the upper cervical. There's no disc between the skull and C1, between C1 and C2. The discs start at C3. Those discs are made up of a fibrocartilage, and it is kind of like an onion, and in the middle is a fluid. Okay, so it's like an onion when you look at it from the side, and when you look at the center, it has a fluid inside of it. When it's cool relative to the body, it's a hydrogel, a gel type of a substance. When it's warm relative to the body, it's more like a water, a hydrosol. That disc has a lot of water inside of it. In order to be able to make the perfect gel, you need the right amount of water in it. The amount of water from a chemistry point of view is 88% saturation, which is 100% hydration. That's as much water as you can chuck into it. And that disc is in its strongest form. You will fracture the bone before you damage the ligaments or damage the disc itself. We know this from Punjabi and White, which is the gold standard on research, and the textbook is the gold standard relating to that. And I agree, they're very tough. You do not damage a fully hydrated disc. You damage discs that are unhydrated. The principle that is important to understand here is that when you fully hydrate the disc, you actually preload the disc. That's an engineering term. If you take a piece of steel and you load it with a weight, it will deform according to how much weight you put on it. If you take that weight off and you weld some cables to that steel and stretch the cables, and therefore stretching the steel, you will cause the steel to be preloaded and will become stronger. So when you put that same weight on it, it will deform less. That concept, it means that the water preloads the disc and causes it to be in its engineering and physics maximum amount of strength to accept its load and to do its job. But when we unload it, when we get rid of some of the water, it unloads it, which means it becomes weaker, less able to handle the forces that are placed on it. When we lose water in the disc, it changes the shape of the disc. It's got nowhere to go but out. It's a lot like losing air on a tire. When you lose air on your tire, it begins to bulge outward. That is exactly what's happening in a disc bulge. We are losing water out of the disc, and it bulges outward. And if that goes to the back, or to the back and to the side, it could potentially hit nerves, affect nerves, or if it goes out the back, it could potentially affect the spinal cord. The spinal cord actually ends at L1, L2 area, but it could affect the nerves beyond that, down in the lower back. And so that is what a disc bulge is. The difference between a disc bulge and a disc herniation is because we've unloaded the disc, it's become weak structurally. It's also placed it in a flexed position, which means the front of the vertebra is sitting forward and more of the weight is over the disc itself. That position, if we get a flexion and a rotation, we can create shear forces within the disc that can tear and push the nuclear material out and create an outpouching, or almost like a blister on the disc. That outpouching or blister we call a protrusion or a herniation. And the definition is that it not only changes the shape of the disc, but it has nuclear material inside of it. That actually can put even farther pressure on neural material, and we don't want that. It can put pressure on the dura and irritate that and other things. So, but the difference between a bulge and a herniation is the injury to the disc. Now, in terms of fixing this kind of a problem, fixing a bulge or a herniation in the medical community is all basically the same. We're going to work, they may send you some PET, but that most of the time doesn't work because it doesn't change the shape of the disc itself. In fact, it normally irritates the structures, aggravates it, and then they look at doing surgery. When they do surgery, whether it's a disc herniation or a disc bulge, they're looking at shaving off the part that's the problem. The problem is, it's not really a problem. You just need to pump it up. And that's what we do here at Advanced Neurospinal Solutions. We've been doing it for the last 17 years. We help you pump the disc up, change its shape, and pump fluid back in over time. This is a process that's a lot like orthodontics. It means that we're doing molding. We're changing the shape of that disc. We want that disc to have a shape where it's bigger in the front than it is in the back. Here's why. If you take a bunch of boxes and stack them up on top of each other, you'll always get a column of boxes. But if you want to make a curve out of it, you're going to have to put a wedge in that's bigger in the front than it is in the back to create that curve. Well, the vertebrae are much like boxes in shape, and if you want a curve, you've got to have the discs have that shape. So let's assume that we have L3 here, and then L2, and L4. See how these are parallel to one another? You're not getting a curve to this system. But what we do is help you to change the shape of the disc so that it's bigger in the front than it is in the back. Okay? That's how we create the curve. We want that shape because the curve is a product, or is a part of a mechanical system. That mechanical system is utilizing lever systems. It depends upon the shape of those discs and the hydraulic properties to maintain those shapes so that it can neurologically drive that system and use the mechanical advantage of that system. There are those that say, well, we could do that with muscles. We could make that happen. And maybe you could, to some degree, improve the shape of that curve without changing the shape of the discs. But then you don't have the mechanical advantage while you're actually in activity. A lot of the things you want to do include actually lifting things, putting forces, loads, moving, pivoting, changing positions very rapidly. And when you have the shape of the discs, you capitalize on what we call the coupling mechanism. More on that later. But when we're creating this curve system, we want to pump the discs up, and we want to pump them up bigger in the front than they are in the back. And we have a very clever system to do that. We're going to include molding, but also a weighting system that causes the neurological system to change your postural positions. But initially, it's kind of like orthodontics. We're going to use molding to change the shape of these discs. My patients are doing molding twice a day. They're doing exercises with weights twice a day, weights on their head and on their pelvis, causing them to change the shape of their posture and therefore the shape of their postural system. Here's the L3, here's the L2, and here's the L4. Now this is pushing straight up 90 degrees to tangent, but this is pushing out this way. So this is going to create a vector pulling the L2 out this way and down this way. This is going to pull this way and down this way. So we're going to get this kind of a internal traction causing us to create these wedge shapes. And we do this over time, over a period of long time, and doing it a lot of times. So like I say, my patients are doing this twice a day, but we can actually see the changes on the x-ray and watch it as it changes. That's why they call me the orthodontist of chiropractic, because we are orthodontically changing the same kinds of tissue that you do when you have braces on. It's a tropocollagen or collagen fiber. It's a coiled protein, and we're elongating it. We're changing it so that it is longer in some cases and shorter in others, because some of it may have to get a little shorter. But we're trying to change it over time, which is called adaptive elongation. There are those who want to tear the tissue, which is called permanent plastic deformation, which actually creates an injury to the disc. It's pathological, but it can change the shape. But I'm not interested in that, because it's going to create a new flaw, and it's going to create over time degeneration. And when you injure it like that, when you do that kind of activity with hard traction, laying on molds with weights on to make that tear, it's going to cause the joints to become very unstable and shut down the nervous system that protects that entire joint system. And it looks like this. This is the injured part right here. And it looks pretty on the x-ray, but you just, in order to change some of that shape, but you just created a flaw that's going to create degeneration, and it's going to create a neurological problem where you no longer have connection to that system because it desensitizes the mechanoreceptors. That research paper is in Spine, 1999. Those are the exact words that they use. So we're going to change the shape of this. But when we do that, imagine if your tire is going flat, if it's lost half of its air, you wouldn't replace the entire car for that. In fact, you wouldn't even replace the tire and the rim. You would pump it up. And if it didn't stay pumped, you'd put a patch on it. Maybe you would replace the tire, but you would try the least invasive thing first. We're looking at pumping that up, but also we're looking at pumping it up in a way that is going to help even with disc herniations. What does that mean? Remember when we talked about that when you lose that water in the disc, it puts the disc in flexion. When we look at it from the side, we look at the disc from the side here, when it has the proper shape, the disc has the proper shape from the side, okay? It puts the nucleus, it shoves the nucleus in this direction. If we lose the water in the disc, the nucleus, here's the bulge. The bulge gets shoved backwards, which is where the spinal cord is, or if it's below the spinal cord, that's where the nerves and the nerve roots are. And so if we pump this up, if we take this and pump it up, and especially pump it up bigger in the front than it is in the back, it's going to put more pressure in the back then in the front, which is going to shove the nucleus forward and move it away from putting pressure on the nerves. We found great success with this, even with disc herniations. Am I telling you that we're 100% with disc herniations? No, I'm not. But we only send about 2% of our cases out, and I get some pretty ugly, gnarly disc protrusion patients. If we can get the pressure off, get the herniation off of that nerve root to where there's no more symptoms without drugs or surgery, by changing the shape of that disc and causing them to pump the water back in, we've been able to avoid the surgery, but we've also put the structural strength back into the system. Remember I said that when you put water back in the disc, it preloads it. So now it's less apt to collapse, less apt to give, less apt to re-injure over time. And so that's the factor that we want to do in terms of putting that patient back into life. We have a reputation of taking people who've been off of work and putting them back to work. And with taking people who have failed back surgeries, not that all back surgeries fail, and there are some that are just absolutely amazing. And if it's the thing you need, man, that's the thing you need. But there are plenty of times we race straight to surgery when other things could have been very, very viable in solving the problem. So, but in working with disc bulges and disc herniations, we've had some very fun success with some very difficult cases utilizing this kind of process. If you have any more questions, let us know and we'll do another video on it. Thanks.